Hey everyone, welcome to April's episode of Health Equity Mondays. You are joined by Omari and the lovely Jasmine. And today we're going to share an interview we did with Dr. Safiya, McCarter, a naturopathic doctor who discussed naturopathy and its intersections with Blackness and a little bit of the history of the Black Panther Party. A lot of great information in this conversation, as well as we talk about this astonishing quote unquote article that was recently released by Stats. This episode is a little bit different than our other episodes and it's a little bit longer, but we know there's a lot of value in this episode and a lot of great conversation and topics that you can take away to talk with all your other health equitists out there.
Hey, welcome to Health Equity Mondays, hosted by Jasmine Leonard
and Omari Richins. Here we'll talk about all things health equity, public health, and culture.
Let's do our part to move health equity forward and all that jazz.
Jasmine, how you doing? Let's check in. Let's check in with the people.
Yes, April has been nice, right? Although today is a little cold, but it's been a good month. I'm trying to think of all the things that I've done. I feel like if I can't remember, that means that it was good.
I think that's pretty solid depiction of it, and hopefully the things that you did were good, positive, and moving you towards your goals.
Yes. How was your April?
I also can't remember what has been going on, but I think that's just a result of like everything that has been going on with work, with the podcast, with the platform. Everything is just progressing well. Be sure to subscribe if you have not as yet, so you can stay up to date with this great content. Just saying, but I think things are going well. Definitely trying to build out some more back end stuff and just finding the time to do that because National Public Health Week was good, but it also took a lot out of me and took me away from the things that I wanted to do. So just stay on the lookout for some new content and new interesting things coming in the near future from the Public Health Millennial. But yeah, doing well.
Yeah, I feel like National Public Health Week, it's Minority Health Month, all of that kind of snuck up on us. So
yeah, Black Maternal Health Week, that also snuck up. Yep. Thankfully, we made an episode about it. We were definitely being very intentional in creating that episode that we can post content on socials around it.
Yes, absolutely. So we like to talk about things ahead of the scope, or ahead of the game, whatever the phrase is. I'm excited for May. Are you excited for May?
I guess so. I didn't really think about it that far ahead, but yeah, I think another month, another opportunity to do great work to move things forward and just continue to grow and build. So yeah, always excited, grateful for another day and another month. So it will come soon. Hope you all are having a good April, and I know May is graduation season for at least most people. So shout out to the soon to be MPH or undergrad grads, or I guess doctorate students as well. Shout out to all of you students in all the realms of life. I guess high school as well, middle school, if you want to go down the realms. Shout out to everyone.
Yeah, May and June, big graduation season. So in June, I'll shout out my special master's graduate who will be walking across that stage. So excited.
Awesome. Well, I look forward to that.
This month, we have an interview that we are about to let you all listen in on. We met with my acupuncturist, Dr. Safiya McCarter, and I think it was a really great interview. I might be biased, but I think she did a great job.
I enjoyed the conversation. I learned about some of the history of acupuncture, and I felt like I learned a lot of things that I need to follow up on just to learn more about it. I think it's not unlike any other medical field in the sense that Black people are not represented at the rates that we would like them to be represented, as well as I loved loved and hate learning about all the barriers to accessing a naturopathic doctor, especially in some states. And Dr. Safiya McCarter went over those barriers very clearly, both on like the workforce side as well as the patient side, which I think is all interesting. So I hope that you all take away some great insights from the conversation.
Yeah.
We're going to feature an interview we did with Dr. Safiya McCarter, in which we discussed the forever hot topic of wellness and how naturopathic medicine fits into the wellness paradigm, and how acupuncture fits into the conversation of Blackness and health equity.
Dr. Safiya McCarter is a dual licensed naturopathic doctor and acupuncturist and owner of Flourish and Balance Integrative Medicine and Safiya M Consulting. Her primary practice is located in Rockville, Maryland, with a satellite office in Baltimore, Maryland. In her work as a consultant, Dr. McCarter facilitates organizations in their work of establishing a standard of equity, inclusion, and diversity, and applying that standard to the work they do and the services they provide. Dr. McCarter currently serves on the board of directors for Black Acupuncturist Association, serving as treasurer, and the National Association of Black Naturopathic Physicians, serving as the inaugural president. Dr. McCarter completed her doctorate in naturopathic medicine and Master of Science in Acupuncture in East Asian Medicine at Bastyr University, Washington, and Bachelor of Science degrees in biology and mathematics at Clark Atlanta University, Atlanta, Georgia. Dr. McCarter is a lover of brunch and nature. On the weekends, you will find her walking, hiking, trying out a new restaurant for brunch, or practicing her new hobby of roller skating. What? Roller skating?
Yeah, I bought some skates and some fuzzy pom-poms, and later then bought a helmet because I kept falling in a very cartoonish like way, like backwards, legs in the air. So I also bought a helmet.
Well, we like prevention here, so we appreciate that. Yeah, and thank you so much for spending some time with us today to discuss like your naturopathic medicine, acupuncture, Blackness, and of course health equity and everything that you do. And before we get into anything, like how did you get into roller skating? Just randomly asking that.
What happened? A friend of mine, my dear friend Lucretia, there's a Anacostia Skate Pavilion here in DC. And she asked me if I wanted to go one day, and I said, sure, why not? And it's always something I wanted to be good at. My father was a fantastic skater. He had these skates that were held together with duct tape, but he was doing all the things. And I never really formally learned how to skate. And so I wanted to, at my big age, learn how to skate and skate backwards. And so then she found lessons for us, and we started going. So it's just started. I am not consistent as I need to be, but that's how it all began. And I'm like, okay, I'm finally going to realize my dreams, and I have a whole outfit in mind for how I want to, once I learn how to skate and skate backwards. It involves fringes and tube socks, and I'm excited about it, but I still need a lot more practice.
As are we'll look out for when you get expert level so that you can send us a video of you skating, and we will share that with everyone. And I think the point there is like it's never too late to chase your dreams and do the things that you want to do. So thank you for sharing that with us.
Absolutely.
All right, so I think I personally know a little bit about naturopathic medicine, but for our listeners, can you explain what that is and what it entails and what we need to know about it?
Yeah, presently, naturopathic medicine is kind of known, or maybe the tenets of naturopathic medicine is known by many names. And so you will hear people refer to themselves as holistic practitioners. So I'm a holistic fill in the blank for the type of practitioner, or they are a functional medicine fill in the blank something. And so what all of these designations have in common is that we're using a Western medicine diagnostic approach. But our treatment is going to employ natural therapeutic methods. And so we're looking at herbs. We're considering, specifically with naturopathic medicine, not just Western herbs. We're also looking at counseling, not in what you would get from your therapist, but motivational interviewing is a component of it. So really being able to have some skills to elicit the kind of information that you need from someone. We use physical medicine, which means we're actually putting our hands on people. So there's osseous manipulation akin to what chiropractors may do, soft tissue manipulation akin to what a massage therapist may do. So that's a component of naturopathic medicine as well. And then we're also looking at dietary lifestyle. So how can we use nutrition therapeutically to address, manage disease, illness, contribute to overall wellness. And then lifestyle factors. What are some of those things that we need to consider outside just physical symptoms that may be contributing to your psychological state, your emotional state, your physical state? So naturopathic medicine really encompasses all of that, but we're also using, because it's medicine, it's a system of medicine, we're also using some of the Western diagnostic techniques, such as diagnostic labs, imaging. So when you're going to a naturopathic physician, you are going to someone that's trained in primary care. And so that's what we provide. You're not going to come to a naturopathic doctor for cardiothoracic surgery. Like, that's not what you want me to do. But basic primary care, or what we may refer to as naturopathic primary care. So what you would go in for your general practitioner for. I have a cold. I have this ache. I'm not feeling well. You can see us for those kinds of things. So we're really combining, I think, the best of both worlds. So conventional medicine, but also natural therapies, which what I found in just working with the patient population that I work with, which is predominantly Black, it's something that's familiar to us. We're accustomed to grandma doing something or mom doing something, so not just Black folks, Black folks in general. So, folks of the diaspora, right? There are things that are very familiar to us that are a part of naturopathic medicine. So the use of herbs. And then even when we get into acupuncture and some of the therapies there, like with cupping, that is a therapy that's used in many cultures also. That's also familiar to people. So I love the fact that naturopathic medicine is also generally familiar to folks.
I learned a lot there because I didn't know it applied like a Western diagnostic technique and then applied like the more holistic side in the treatment perspective. So I appreciate you sharing that because I did not realize that. And then in speaking about that, I've known a couple of doctors of naturopathy. How did you decide? And what's your story of getting into becoming a doctor of naturopathy?
Yeah, so I've always wanted to be a doctor. Since I could speak, that was what I was going to do. And so everything that I did from the time I was, 12 years old through, and onward was related. So my extracurricular activities were primarily academic in nature. And so I was involved in a program that allowed me to go to a hospital. I'm from Rochester, New York. And there's a hospital there, the University of Rochester, and then Strong Memorial Hospital. So I was involved in this program called STEP. It's a Science and Technology Entry Program. And that allowed students that were interested in pursuing careers in medicine to take classes, get tutored by medical students that were attending the University of Rochester. And then we also could shadow physicians at Strong Memorial Hospital. So every week from the time I was in 7th grade to the time I graduated from high school, I was at this hospital. And then on Saturdays, doing coursework, getting tutored. And so but that was a part of my path and a part of, sort of the constellation of things that you needed to do if you were interested in being a doctor. You had to have some shadowing experience. You had to really understand what the demands of the profession were so that you were making an informed decision. So all of this was so that when I applied to medical school later down on the road, I had the decades long or more experience of really understanding what it was to be a physician and just this tangible experience. So I was on my way I wanted to be a pediatrician. I love babies. And so I wanted to be a pediatrician and was doing all the things. And, at that time, you had to be you didn't have to be, but you had to be a biology major in order or that was the thought. You major in a science, most often biology, again, at that time. You took Latin, which I did because medical terminology has Latin roots. So I took Latin, AP Latin, did all the things, and also had this experiential component as well. So well on my way. And so I had no idea what naturopathic medicine was. I wasn't familiar with acupuncture outside of, and this may sound funny, but my mom loved Kung Fu movies. And so we would watch them all the time. And so you would see that component but it didn't it didn't register. So those things were on my mind. I had no idea. I knew allopathic medicine, that was the route. But then my father got sick. And my father, as I mentioned before, he was a skater. He was an athlete, relatively healthy. My mom was primarily a stay-at-home mom, so she cooked every day. He was healthy. And then what seemed to be, a rapid and dramatic, his health declined. And he had several strokes. And his treatment, which led to a number of health complications for him. And so we're grappling with all of this. And at one point, he was on 14 different medications. And they weren't really being managed very well. And so 2 of the medications were interacting, causing him to faint. And so no one could figure out why he was fainting. So wherever he could just be anywhere. My father was a fisher. And so we had a little boat, he might just pass out, so his life was acutely in danger because of this. And finally, when one person on his medical team looked into it, what they discovered was that 2 of his medications were interacting, dropping his blood pressure too low and causing him to faint. So that was corrected. He was okay, but damage had been done because of all these fainting episodes that he was experiencing. And that was a turning point for me. I said, how could this happen? How could this go on for so long? How could other factors like, diet, lifestyle not be considered in his treatment, particularly with chronic diseases? So high blood pressure, high cholesterol, diabetes, all things that, he had. Like, why wasn't this discovered sooner? Why weren't certain conversations being had? And I felt like there had to be a better way, a different way of approaching health and disease and treatment. But I had no idea what that was. And, my mind as a junior in college at that point I was heartbroken. I was angry. And I said, I need to do something else. I can't participate in this system if this is how people are being treated. But I had literally no idea what I was going to do. All I ever had done had been geared toward medicine. I said, well, I like kids. I want to work with kids. My favorite subject is actually math. So I'm going to do something with the education of children. So I dedicated my life to the education of children. I started teaching because I still wanted to work with kids. And I quickly found out that wasn't that wasn't the way. I have a deep appreciation for educators. Deep. But that wasn't the way that I was supposed to work with kids. And so a friend of mine actually introduced me to naturopathic medicine. She gave me this pamphlet and she said, have you heard of this? And I said, no, but when I read through the pamphlet and read about what naturopathic medicine was and the things that it considered and how people were treated, it really resonated with me. And I said, this is the kind of medicine I want to practice. Like, this makes sense to me. And it was also, again, familiar to me because there are things that my mom used to do. My mom always had a garden and she's like, go get fresh air, go get exercise. You can't eat a lot of sugar. You need to, have regular bowel movements. That's very, very important for a variety of reasons. So she was, doing these things that, didn't make a whole lot of sense, but we did anyway because Rosa didn't play. So we were going to do what Rosa said. But getting into the program and learning like, oh, this is why my mom said, don't eat so much sugar. It's inflammatory. This is why my mom said, go outside and get some sun. Oh, vitamin D production and the impact that the vitamin D status has on mood, immune function, bone health. Like, oh, I don't know that she knew those things, but learning the science behind why my mom did some of the things that she did really validated for me that this was the thing that I was supposed to do. It was something that I was connected to. It empowers people in a way that I really like. And so I love the fact that I can tell folks, go in your cabinet and get this spice, this herb, make this into a tea, and that will help you with your cough, and you'll be able to sleep through the night. I love that aspect of it. So, after being introduced to it, just going back a bit, I just did some research. I wanted to know that it was legitimate because I hadn't heard of it. So me and, all of my ego of, I haven't heard of it, and I've been involved in medicine for all, since I was 12 years old, then how can this naturopathic medicine profession be legit? So I started about 3 years just looking and comparing the different curricula of different ND schools to that of conventional medical schools. And I mean, deep diving. So I'm looking at the course descriptions. I'm like, okay, so anatomy over here in the school that I attended versus anatomy at Morehouse School of Medicine. Who else did I look at? Meharry, University of Rochester, because Rochester, and Emory University, because I was living in Atlanta at the time. So I'm doing a class by class comparison. I'm looking at the bios of the professors because I want to make sure that the education that I'm going to get is solid. And over that time, in addition to doing that, talking to people that were in the profession. And so they would do health fairs and career fairs, and someone from Bastyr, which is the school that I went to just north of Seattle, would come and participate in these fairs. And so generally it was someone that was a naturopathic doctor, so they could answer those questions about what it was like to be in the profession. So I did that over the course of 3 years, and then finally I said, okay, I'm ready to apply. I did, and then I began to learn all of these things. And it was phenomenal. It was a fantastic experience. And I appreciate the knowledge that I have that I can take literally anywhere. So I can always find some herbs. I may not always have access to medications, but I can always find some herbs. I can always do things with my hands to help people. So I love that I have these fairly simple tools that can result in a profound effect for people in their health and their well-being. In my mind, I was going to tell a much shorter story.
It's okay. I think I'm long-winded too, so it's fine. But I appreciate how similar our stories are, and the fact that, you found naturopathic medicine, I found public health. Yeah. Omari's story is a little bit different, but also found public health. And I think it's beautiful how, we all start with these ideas in our brains, and then the universe brings us what it needs to bring to us.
Right.
So low key, when my mom used to say, put an onion in your sock for a fever, is that naturopathic medicine? What is that?
That is a part of it. And so,
okay.
And it was funny. I was talking to my barber, speaking of onions, the other day, and he said, growing up, my barber is Haitian. And he said, growing up, my mom would make this onion syrup. And we would take that whenever we were getting sick. And I was like, oh, absolutely. Like onion, garlic, they are fantastic. They're antimicrobial. They are fantastic. I taught a whole series of when I was in Seattle, kitchen medicine. And included in that was, how do you make onion syrup? How do you make garlic? How do you make it and utilize it when you are trying to treat a upper respiratory infection? So you have the cold, you have a flu, you have a sore throat, you have a cough. The properties are incredibly therapeutic and beneficial. And so he's like, what? Yeah, I told my wife that because she was like, no, I'm not doing that. But he's like, yeah, I took it and was fine. I'm like, absolutely. That is absolutely medicine. And so the idea of putting the onion or, something called a wet sock treatment, which helps to draw out fever, those kinds of things would be included under the umbrella of naturopathic medicine. You're using elements of nature to treat.
See, moms be knowing.
Really? Because my mom's like, get some apple cider vinegar. We always had apple cider vinegar in the house. And so I remember having a really bad sore throat. She's like, get you a tablespoon of apple cider vinegar. I'm like, okay. So I take it, things come up and sore throat gone. And I'm like, oh. And now you see all these things coming out about the use of apple cider vinegar. And I'm like, Rosa knew. But, I mean, again, coming up, my mom's family they were migrant farmers. And again, we always had a garden. So it was always, food and, what do we have? And then access too. So growing up in the South, limited access to healthcare, quality healthcare. My mom was born in 1939. My dad was born in 1940. So that time, particularly in the South, there was just limited access. So what do we have? What do we have on the land that we can use? What does, this person that, the medicine person in our community, what knowledge can they, help us to obtain so that we can treat the things that are going on with us or our family members? And so she carried some of that with her. And again, fast forwarding, to 2005, when I went into ND school, again, like learning the science behind some of that was phenomenal. So yeah, medicine.
All of it. All of it's medicine.
All of it.
So oh, go ahead, Omari.
I'm just going to say like that. It's very fascinating that like these things that just happen, as you said, like we didn't have access to typical medicine. So it's like, how did we find those ways? And a lot of the times it comes from like ancestral leanings or like passing down just from generation to generation. And me coming from Trinidad, like you're always like, yeah, go get some bush tea or something like that, which is something that has definitely helped in a lot of circumstances. I just wanted to highlight how amazing that is, that like this type of traditional holistic view of medicine is something that has been passed down, and especially for Black people of the diaspora, and how important it has been for our wellness as a people. And I'll pass it to Jasmine.
Absolutely.
So, speaking of the greatness of Black people, something that I've been wanting to talk about for a while. So I work with a consultant out in Oakland, California.
Oh, yeah.
So I was talking with her, and recently, she was bringing up the fact that the Black Panthers brought acupuncture to the United States. Like that was one of the many things that they brought to the Black community. And I started wondering, like, is this the first time that the Black community was introduced to acupuncture in the US? Like, because when I initially think of acupuncture, I think of, like Eastern medicine. I think of Chinese, practices. Yeah. I don't think of Black people, but clearly I'm wrong. So what's the history?
Yeah, so that's a whole other podcast episode.
Okay, we can do that.
And but really, I would tag my friend and colleague, Dr. Tanisha Dandridge, who's done a lot of research around the Black African influence, connection to acupuncture. Like that was a part of her, her PhD, her doctorate program, in doing a lot of research around that. So she would be much better, to discuss that than I. But yes, I mean, on a large scale, yes. And as far as it pertains to the Black community, yes. I would say Black and brown communities, because it was the Black Panthers and the Young Lords, at least in New York, that came together to work together it was the Lincoln Detox Center or Lincoln Recovery. So that was I believe in the South Bronx. Specifically with the Black community, and this was around the 70s. And so on the West Coast in Oakland, Dr. Tolbert Smalls was instrumental in bringing acupuncture to the Black community via the free medical clinics that the Black Panthers had established. On the East Coast, Dr. Mutulu Shakur, Tupac's stepfather, was instrumental in bringing acupuncture to the Black community. So again, and during that time, if we think about what's going on in Black and brown communities, the influx of drugs, particularly heroin, and how it ravaged our communities. And so, again, the recurring theme of a lack of access to adequate medical care and detoxification from heroin, and those kinds of programs. And so the use of acupuncture as a way to detox from heroin. So that's how it started, but not just heroin, not just using it as a detox from heroin, but other, health concerns as well. But during that time, 70s, both places, utilizing the efficacy of acupuncture to detox them from opioids, which was used. And this is what Dr. Smalls found out, and and sort of brought back during the opium wars and the high population of Chinese folks being addicted to opium. Acupuncture was used to help to detox them from opium. And so that same theory, that same science was used to help to detox folks from heroin. And at that time, the detox protocol, they had methadone clinics, and methadone is like heroin. Mm-hmm. So it's a narcotic, and they were giving that to lessen withdrawal symptoms and cravings for heroin. But, folks like Dr. Smalls, like Dr. Shakur, the Black Panthers, the Young Lords, they're like, we don't want to give our people another drug to help them detox from this other drug. Like that just doesn't make sense. And so if we're fast forwarding present day, we have this whole opioid epidemic. And mm-hmm. So they're like, we don't want to get people in this cycle of depending on another drug to get off another drug. And seeing the efficacy of acupuncture and utilizing that as a primary form of treatment and servicing specifically Black and Brown people. So yes, on a large scale, that is how in the Black community, Black folks were introduced to, in the United States, were introduced to acupuncture and the use of acupuncture, the efficacy of acupuncture.
That's amazing. Thank you for that history, because that is not something we hear about a lot of the times. And I think just raising up the importance of what the Black community has done to bring this type of work and to think about that holistic perspective of let's not treat one thing with another thing that is essentially just a drug that is a lesser worse drug mm-hmm. in a lot of senses. And how do we fix this and think about how do we prevent it, or have just a more natural or holistic or more wellness-based approach to this, which is awesome. And then given this history in the US, when do you think acupuncture became so white?
When you realize you could make money off of it. I mean, but that's also documented. So if you look at some of the things that Dr. Shakur wrote, it's so now the protocol that they developed, this 5-point detox protocol, morphed into something that's called NADA. And so now it's just, you can make money off of this protocol. And that's not the spirit with which it was created. So now, you can commodify it in this way. And again, access, to formal education. And so Dr. Shakur received his doctorate in acupuncture in California. Dr. Small was a conventionally trained physician that learned while he was in China, learned some of the basics of acupuncture, and continued to practice. And then they gathered all the information that they could find. So to my knowledge, I don't believe Dr. Smalls obtained a degree or certification in acupuncture, but learned sort of in its apprentice-like fashion, the science behind the usefulness of the point location, and so gathered resources to help train himself and other people. And then it was shared with other folks. And then they developed, again, based off of the history of acupuncture being used to detox folks from opium. How can we then translate that to what we're trying to do right now in the Black and brown communities? And so they began to teach each other, practice on each other, develop this, this protocol. Formal education in acupuncture and naturopathic medicine is incredibly expensive, wildly expensive. And so the access to that education then becomes incredibly limited to people that look like me and you all. And so whether, intentional or not, I think that is that's the beginning. Like, oh, this is something that money can be made off of, and let's see how we can mass produce this and get it out and make money off of it. That then leaves behind this whole population of people that it was originally intended to serve, and also excludes them from access to it. And so present day, the percentage of Black acupuncturists in the United States is small. I'm forgetting in this moment the actual percentage, but I want to say it's less. It's definitely less than 10%. So very, very, and that's within the United States. It's very, very small. Same thing with naturopathic medicine. Both professions are predominantly white, predominantly female, predominantly white. Well, predominantly white female. And so, and it just, continues to be the case. And again, it's incredibly expensive to get these degrees. And you don't have as many options for schools either. There are more acupuncture programs, acupuncture schools, and naturopathic medicine programs in schools. And so you have just limited access on a number of levels.
That costs the school though.
Yeah, and and it's real, and there's a reimbursement, insurance coverage, and so in the state of Maryland, my services as a naturopathic doctor are not covered by insurance. So that's another a limiting factor as far as access is concerned. It was different me living in Washington State where it was. All health insurance policies don't cover acupuncture, but at least they do. So folks have access to me. They have greater access to me as an acupuncturist than they do as a naturopathic physician if we're just talking about the insurance model. And so my thing is, whatever gets you in the door, and because I'm trained in both of those things are going to be incorporated into your treatment because they're effective. And, because they're effective and necessary. So unfortunately, myself, particularly with my combination of degrees, I'm like this unicorn. There aren't very many people that look like me that have my combination of degrees. And I'm not in this area and overall. It's growing. Our presence in these fields is growing, but the growth is glacial. And still, overall, we represent a very small percentage of practitioners when it comes to naturopathic medicine and acupuncture. My someone that I work with has a Korean barber, and I see him for acupuncture, and he had cupping marks on his back. And somehow they saw that when he was getting this haircut, and they're like, "Oh, you're doing acupuncture." He said, yeah. It's like, "Oh, you got some cupping done." He said, "Yeah." And they're like, "Oh, is your acupuncturist Asian?" And he said, "No, my acupuncture is Black." And they were like, "What?" And they're like, "Yeah, it's a Black woman." "Wait a minute, a Black woman?" And they were shocked. And we were cracking up laughing as he's telling me this story. He's like, they were so surprised. And then they said, you don't see many Black acupuncturists, and you really don't see very many Black female acupuncturists. And this is, his Korean barber saying this. And so you do not. And, I think there's some people that seek me out specifically for that reason, which I'm okay with. So yes, it is something that has a history. It's a part of our history, and it's incredibly effective. It's a relatively low cost. There's not a whole lot of instruments that are needed in order to, again, have a very dramatic impact on the health and well-being of folks. So it's wonderful. It's wonderful for us.
So since you mentioned that people come to you for, a lot of reasons, I'll say that Dr. Safiya is my doctor. So I came to you for a number of reasons. And one of those was including feeling burnout. I like to be transparent on the podcast. So I was crispy burnt, I think. And so there was a recent interview with some Deloitte professionals, and they said that companies are investing over $10.5 million a year in wellness programs, but the employees are still burnt out. They're still kind of like, this ain't it. So one, what are your thoughts on this? And then two, when these companies are thinking about their wellness programs, do you think acupuncture and naturopathy should be like just an integral part of that?
What do I think? Firstly, I think that the corporate wellness programs, that's becoming a larger and larger industry. So I know folks that are in the corporate wellness spaces, and that's what they do. They provide corporate wellness programs, and they stay employed because it helps. It also helps the company's bottom line. I can keep the folks that work for me productive and healthy and happy, and they come to work and they do the work and they make us more money. So there's that aspect of it. And there are, we're having increasing conversations around, what else can be done besides putting somebody on a narcotic. And so this, this continuing conversation that we're having around the opioid epidemic and, what else can be utilized. So, and we spend so much of our time at work, right? So we spend a large portion of our lives, of our days at work. And so I think that it makes sense to invest in people. Reasoning aside, motivation aside, it makes sense to me to invest in people and to ensure their health in the space where they're spending the majority of their time. So I on one hand, I like the idea of these wellness programs. So if I'm spending all my time here, do I have access to things that are going to keep me healthy? Do I have the option of a standing desk? Is there a gym that I can go to downstairs? Is there a walking group that we have at work? Do we have someone, that's coming in providing like a Zumba class, or something? So I like that idea because you're increasing the access, because gym memberships over time, so the expense and the additional time that you would have to take and spend to get to your gym, to take the class and pay for the memberships. So I like the fact that those are things that are being incorporated into the workplace and into the workspace. Absolutely. If we're looking at utilizing therapies that have little to no side effects, then I absolutely think that acupuncture and naturopathic medicine have a place and should have a place or a space within these corporate wellness programs. If we're looking at the community acupuncture model where people are, just sort of in a large space getting treated all at the same time, that is something that can be incorporated into a corporate wellness program. So come on down to the treatments will be fairly simple. It wouldn't be like at my clinic where you're on a table in a private room. You're basically in reclining chairs and you're probably getting, that 5-point protocol, which is good for other things in addition to detox. So some points that are just going to help you to relax and reduce stress and, calm the mind, calm the spirit, as we say in, Chinese medicine. So I think that it can absolutely be helpful. Most people are incredibly relaxed or they fall asleep when they're on the table. And then they carry that sense of relaxation, those feelings of relaxation throughout the rest of their day. And so that could be incredibly helpful for reducing stress in the workplace. And, we understand all the adverse impacts that stress can have on the body on a multitude of levels. And so if we are really thinking about really impacting the health and well-being of people, then absolutely incorporating acupuncture and naturopathic medicine into those corporate wellness programs would be a fantastic idea.
Okay, so our employers that are listening, y'all heard it.
You got my vote right there. And then, as you were speaking a little bit earlier, you said that there are less than 10% of Black acupuncturists in the workforce. So how do you think that we get more Black people interested in acupuncture as a workforce as well as on the patient side?
Well, I think that on the workforce side, the cost of education is, not just for, acupuncture, naturopathic medicine, but when you look at the cost of education and compare that to, reimbursement, if you're on the insurance model, there's all kinds of conversations around poor insurance reimbursement for the services that you provide. And so I've spent almost, $200,000 getting this degree, and you're trying to pay me $4 for spending 30 minutes with somebody. That's just not going to, the return on the investment that I have made. And I'm not saying that, there are very successful, wealthy acupuncturists out there. So it's not that it's impossible to make a living. It just depends on the model that you have. And if you are insurance based, that can be, you'll get volume because people are going to use the benefits that they're paying for, but the reimbursement is an issue. And so your treatments are then, confined to what is allowed by insurance companies. So, it's a larger conversation. And so reimbursement, the cost of education, increased advocacy and awareness. And so, people like me need to get out and talk more, and people need to see, people that look like me more, as an acupuncturist, as a naturopathic doctor. Licensure, not so much an issue with acupuncture, more so an issue with naturopathic medicine. So naturopathic doctors are not licensed in all 50 states. And so I want to say there are 25 states now, 23, 25 states now that license acupuncturists. So I am licensable in Maryland. I am licensable in DC. Well, 25 states, including the District of Columbia, right? Okay. But not licensable as a naturopathic doctor in Virginia.
That's not surprising.
And so, licensure, scope of practice. My scope of practice differs depending on where I am. And, how I'm able to provide that holistic care differs significantly enough for me that it becomes challenging. And so I moved from a state where in primary care, I had prescriptive rights. So I could manage your medications if you were on them, prescribe medications should they be needed, because they are not anti-medicine in any way. Despite what brought me to naturopathic medicine, I recognize, wholeheartedly that a combination works for the vast majority of people, depending on their overall health profile. And so not being able to do that limits my ability to provide this continuity of care, because, folks are coming specifically seeking me out because they're looking to decrease their medications if it's safe for them to do so, prevent going on a medication, again, if it's safe for them to do so. And so they want to look at what else can be done. But I can't manage their medications in that way. I can't titrate them down. I can't or up. I cannot do that within my scope of practice in the state of Maryland. So finding a conventionally trained doc to work with me to create this plan for someone to help them live in a way and manage their health in a way that they want for them can also be challenging. So it's it makes it a bit more difficult. And so I have to have that conversation with people like, hey, have you worked with a naturopathic doctor before? Here are some of the limitations. I'm a part of your healthcare team. You're still going to have a conventionally trained physician that is going to be able to provide you medications, prescribe you medications should they become necessary. I can provide you with some information, and I can also provide you with the information about how to safely combine those medications with the natural therapies that I'm going to recommend, but you still have to have that person on board. If they're open to working with me and speaking with me and collaborating for your care in that way, I'm open to doing that. That would be optimal. But if not, here are the questions that you're going to need to ask. And so there's more advocacy that the patient then has to do for themselves. So scope of practice, licensure, insurance reimbursement, cost of education, all of those play a role in the current demographic makeup of the professions. On the patient side, folks are like, needles. You're going to poke me with needles.
It doesn't hurt.
Doesn't look that way though.
Like, you gonna do what? And fire? Why you have that fire? What's that fire?
Hold on. I haven't had that. Wait,
you haven't had the cupping. It's the fire cup. I do, what I refer to as traditional fire cupping. And so the cupping technique, that particular therapy, a flame is involved, and the glass cups are used to help create the suction that's used for that particular therapy. But there are also pump cups that you can use as well. I don't use those. That's not how I was trained. I was trained with fire cupping, so that's what I do. And so I'm most comfortable doing fire cupping. And so folks are like, what is this? What here, a lighter? What is that? And then, generally I'm explaining this is what I'm going to do, but I've had a couple of instances where I forgot that I didn't tell the person, I didn't explain it to them initially. So this happened on 2 occasions. They're like, what is that? Where are you going with that fire? And I'm like, oh, I'm sorry. Let me tell you what I'm about to do. I was like, I'm so accustomed to doing it and telling and explaining it. But in those couple of instances I didn't, and the reaction was really funny. They're like, why are you near me? I remember doing a talk once to some students. I think I was here, actually. This is when I still lived in Seattle, and I was traveling because, as I mentioned, there was these career fairs. So when I got to a certain point in my naturopathic program, basically when I got to the clinical part, so I could start talking about how this is used, in clinic, I was doing some recruiting work. And that was also something very important to me because I wanted people to see that I was doing this, like I was in this program, particularly having moved from Atlanta to Seattle. It was really important for folks to be like, Seattle from Atlanta? What was that like? So being able to answer those questions and living in Seattle, as a Black woman. And so I remember describing naturopathic medicine. This was specifically naturopathic medicine. And one of the students said, this seems like a luxury. This doesn't seem like something that everybody would be able to access. So how does this actually work? And at the time, that's never what I thought. My idea and my connection to naturopathic medicine was one that, again, it was familiar to me because of, what I saw my mom doing and what, she did for us as far as, health maintenance. It never occurred to me that it would be considered a luxury and something that was not accessible by all people. And I fumbled through some kind of answer that clearly, from the look on that young lady's face, was not at all satisfactory. But then I began to think about it like, for some people, especially in instances where it's not covered by insurance and they're paying out of pocket, it can be pricey to access me as a naturopathic doctor. It can be pricey to access me as an acupuncturist. And so there is some struggle, around that. And people have to make the decisions that they have to make. And most often, if I have to choose between, me and my kid, I'm gonna choose my kid every day, all day. If I have to, make certain sacrifices, and typically we're going to sacrifice ourselves for the people that we love. We're going to sacrifice ourselves so that we can go to work, so that we can provide, and that's not the case for everybody, of course. But, that is also a reality of some folks. And so it's seen as this thing that's, not accessible. It's seen as a luxury. And that's also kind of how it's marketed in some places, in some spaces. You don't typically see it as something that is essential, which it is, but something that you do that has become popular by like health gurus and influencers. And so like, oh, I just went to see my naturopath, and and so it's has been presented in a way that makes it seem like a luxury rather than a necessity. I've seen that. And presenting it as a necessity, presenting it as something that can overall in the long run be cost effective for people, I think would be helpful in getting more folks, more Black and brown folks, in the door. And that requires work on our part as Black naturopathic doctors, as Black acupuncturists, to do things like this, right? So agree to be a guest on a podcast, agree to speak, to be on panels, to show up at health conferences, and present and share information, with the community, so that it seems more accessible. But like, okay, if you're saying it and you do it, then maybe perhaps. So yeah, I think you have to figure out ways to make it more accessible to people.
So basically, our employers need to start putting these in the wellness programs. Insurance needs to have better reimbursement. Schools should be free, and especially for people of historically excluded communities, i.e. reparations. And acupuncture, naturopathic medicine, like these are things that our parents and stuff have been doing, and we just didn't know about it. Okay.
Perfect summary. Pretty much, folks. Pretty much.
Okay.
There it is.
Okay.
There it is.
So
yes.
I jokingly said last week that I wouldn't ask this question, but I'm going to go ahead and do it. So, as I said, Dr. Safiya is my doctor, but I'm assuming that now people are going to listen to this and they're going to be like, I want a Black acupuncturist. So how can people get in contact with you, or how can they potentially become a patient? But you cannot have my space. Okay, that's just all we have to say about that.
Tuesdays at 3:00 belong to somebody. Don't even think about it. It's just not available. So my practice, Flourish and Balance Integrative Medicine, is located in Rockville, Maryland, at 6282 Montrose Road in the Montrose Professional Park. In Baltimore, I'm at Charm City Natural Health, which is at 4800 Roland Avenue. And I'm there on Mondays. My website, flourishandbalance.com, all the information about the things that I do and where you can find me is there. So again, flourishandbalance.com. And then I'm on LinkedIn, Facebook, and Instagram. And you can find me in all of those places at Dr. Safiya ND. So that's DrSafiyaND. So that's my handle. I'm old, so that's my handle. Okay,
that's your handle.
I need the youth to help me out for LinkedIn, Facebook, and Instagram. And then I also have my business page on Instagram, which is Flourish and Balance. Yeah, so those are all the places that you can find me.
Awesome.
Okay, so everyone's gonna come and have an appointment. They won't have mine though. So that's fine. We're gonna get you some business now.
Perfect. Thank you. But also, if you're looking just for a Black acupuncturist, so the Black Acupuncturist Association, there's a directory there. And of course, I feel terrible because I am forgetting
We'll put all the links. So typically we have all the links and resources for everyone in the episode. So we can put the link to that because I'm pretty sure that's how I found you, because I was very specific in being wanting a Black acupuncturist. So we'll get all that information for you all.
Perfect. So so blackacupuncturist.org is where you would go and get a listing. I'm listed there, as well as it's not all Black acupuncturists, but a good number of them across the country where you can, find them and receive care if that is what you're looking for.
Cool. Well, I want to thank you so much for being willing to come sit with us and talk about all the things. You were gracious enough to say yes the very first time I even mentioned it. So thank you. And I know our listeners are appreciative as well, because you dropped so much knowledge, so much that I'm like, all right, who can we have on next? When can we have you back? And what are we going to talk about?
Thank you so much for extending the invitation. It is just, a part of my mission, my personal mission I took a break from speaking and, accepting invitations. But so I'm getting back to that because, as I mentioned, we need to do more of this so that people can understand that we're out here, we're here. And, that we are a part, of this medicine. So thank you for the invitation, for thinking, enough of me to want to hear what I had to say about things. I appreciate that. I definitely appreciate what you're doing, the work that you're doing for this podcast. And again, thank you so much for having me, you and Omari. Thank you.
Thank you so much. Truly, truly is our pleasure. Wow. So let us know which parts of that conversation you enjoyed the most, what you learned more about. And remember, all the links to the show are below. So definitely check those out if you're interested in learning more about anything that we talk about in these shows. And as once again, be sure to subscribe and follow us on Instagram at Health Equity Jazz and at the PH Millennial. Definitely appreciate you. And that's on Instagram. You can find us on LinkedIn and all those other platforms as well.
As always, I hope that you all are reading my newsletter, Becoming Dr. Health Equity Jazz. If you have not subscribed yet, it is a monthly newsletter where I'm talking about all the things doctorate in public health. I'm talking about why I'm a good troublemaker in class and why now some people don't respond to my emails. All the things. So if you want to subscribe to that, you can find links on LinkedIn. You can find links on Instagram. It's also, if you're listening and good with tracking down URLs, it's www.healthequityjazz.beehive, beehiiv.com. And if you are following me on LinkedIn and Instagram, you probably saw that I am doing a live event. Like, I don't normally do this. So this is Omari's, I think he's rubbing off on me, but I'm doing a live viewing of From Sarah to Serena. So I actually mentioned that in our February episode. So if you haven't listened to February yet, go back and listen to that. I think it's a great time to go ahead and share it with you all for free. So if you are available on April 30th, the last day of Minority Health Month, I am sharing From Sarah to Serena, and we'll have a cute little discussion afterwards about that. So you can find information on LinkedIn and Instagram for that. And then lastly, I am doing the American Foundation for Suicide Prevention overnight walk. So I would love your donations. And if you're interested in walking, it is a pretty steep fundraiser goal. But hey, if you can do it and want to do it, more people, the better. You can find information on Instagram and LinkedIn, again, about how to donate. And I also have an exclusive shirt. So I like my HEJ merch. There's an exclusive shirt for this walk that I hope you all take a look at and potentially purchase.
Awesome. And I think Jasmine forgot to mention that all of these will be linked below. So you actually don't have to go to LinkedIn or Instagram, but you can, but if you like to, like, feel free to do that as well. But everything that you just stated will be linked below. So just click on those links and fit in where you fit in, right? Is that what they say? As well as like give us more about what should someone expect if they go into this event on April 30th.
So, From Sarah to Serena is a small short film documentary ish thing that I did a few years ago that goes over the medical mistreatment of Black women in the United States. It's a history lesson, and then you get some current stats. And because I don't want to be a Debbie Downer all the time, it ends on the fact that there's hope if we try to get to it at the end of the tunnel. And so I think that it's a powerful video. People have said that it is. And so afterwards, I'll have time for discussion and questions and all that stuff.
Seems like it'll be a very insightful conversation and some way that you can really engage as someone that is interested in public health or health equity or the intersections of that. And I think it's always great when you can come together with like-minded people because you never know what you're going to learn or what that space is going to do for you. So I appreciate you holding that space. And once again, that's linked below. So promos for me this month, like be sure to subscribe to this podcast and share it out with other people who would get value from it. That is like the greatest support that you can give to this show, to this platform, to the work that we do. A lot of the times it is very thankless work. So definitely let us know if you enjoy these episodes or if there's something that really stood out to you. We appreciate that. We appreciate if you leave like a 5-star review or like you can leave a review and just let us know how we're doing, whether that's a 5-star, preferably a 5-star, but like let us know we're all here for good, bad, and everything in between. And I think like just understanding where we can be better is always appreciated. My laptop is on its last right now, so if you'd like to be a contributor and support me in getting a new laptop so that I can continue to do this phenomenal work and put out great content for you all, be sure to check out that link below. It is to Ko-fi, a website that allows you to be either a one-time contributor or a monthly contributor to the Public Health Millennial platform and thus the Public Health Careers and Health Equity Mondays podcast. So if you're interested, be sure to support that. As well as I do have a shop. You can go to thephmillennial.com/shop and shop there for something that you might want to wear during these summers. I did add more colors than just black because everything was black before. It's hot outside. So check that out if you want to support in that way as well. I greatly appreciate you all. And once again, be sure to subscribe. And if you get value from this, share this with someone who'd also get some value from it. We greatly appreciate it.
I had to send you the text message about this quote unquote astonishing article that was posted, I think this week, right?
Yeah. Yep. It was this week.
Okay, so we have to dive into this, but while I'm bringing this up, let's see.
Yeah, while you're bringing that up, I did have a couple things to mention. So the article is talking about, broadly speaking, and Jasmine will dive deeper into like the more details from the article and give her insights on it. But just talking about how when a black physician is present in counties, it it leads to longer life and better health outcomes for black people. And I think, as Jasmine said, it's not necessarily astonishing, at least from our perspective. But I'm glad that like a big platform is raising this up and that we can continue to forward the conversation, as well as I just think it's important, especially that we are both public health professionals here, to acknowledge that there is a shortage of around 80,000 public health professionals throughout the entire United States. And I think that's a stat and something that we don't talk about enough. But it's important to highlight because yes, we know that medical care is important, but when we look at the social determinants of health, that only factors into 15-20% of your overall health, while all the other social determinants of health, which are affected by public health workers, factor into the other 85% of your health. So just wanted to put that out there to say, yes, this is important. And yes, we need to focus on other broader social determinant of health issues so that we can achieve better health outcomes for Black people and other marginalized groups, of course.
Absolutely. So, like Omari said, this issue that we're going to talk about from the Stat News article is only 15 to 20% of the pie. We still have a whole lot of stuff to worry about, but as they say, this was quote unquote astonishing. And astonishing to who? Because I looked at this and said, well, duh. But I've highlighted some things for us to go over. So, the big takeaway here is that Black people in counties with more Black primary care physicians live longer. Again, I feel it's feeling kind of okay.
Yep.
Um, It says this is the first link to a higher prevalence of Black doctors to longer life expectancy and lower mortality in Black populations. So the first study of the many studies, this is the first one to do this, to do that. And it says the new study found that Black residents in counties with more Black physicians, whether or not they actually see those doctors, that I think that part is a little bit interesting.
Right.
But whether or not they see the doctors, they had lower mortality from all causes and showed that these counties had lower disparities in mortality rates between Black and white residents. The finding of longer life expectancy persisted even in counties with just one Black physician.
That's amazing.
Right?
It's pretty wild. Pretty wild.
It is. And, you know, how much life expectancy happens from this. So they found that life expectancy increased by about 1 month for every 10% increase in Black primary care physicians. And so a month may not sound like a lot, but given the disparity between the life expectancy between Black and white Americans, 1 month matters. And if you've ever lost someone, you know that any time that you can get is better than no time. So, honestly, it's not astonishing in this article at all, but it is very interesting information. They said that they were not able to directly address the reason that Black people fare better in counties with more Black physicians, and it's not proving a cause and effect relationship. And they did find that improvements in life expectancy were greatest in counties with the highest rates of poverty. So, what are your thoughts?
I think all of that makes a lot of sense. I'm interested. I didn't get to read the entire published article, but it'll be interesting to see like how this was designed, what other confounding factors were considered, like were the counties that happened to have more Black physicians also counties that had like higher public health funding or higher social services funding or had Medicaid expansion or whatever the case might be to really like to signify that yes, Black physicians are important and these are the reasons why they're important. But I think it's a great start to this type of understanding of why we need Black physicians, why we need Black professionals in health serving roles, whether that is a physician, a PA, a naturopathic doctor, or a public health professional. We just need to ensure that there is representation because in some of the work that I did, some of the work that I shared, not that I did during National Public Health Week, it just showed that when someone is speaking to someone that is similar to them, their health outcomes tended to be a lot better. And I think just understanding how we can address this in the medical curriculum and how this could be implemented at a broad scale is something that's important and could have huge implications for health outcomes for Black, Brown, and other marginalized communities around the U.S.
Yeah, I think one thing, and I also need to read the original study. You know, this is a good piece of information for everybody. Like when you see these articles, there's always a study that they're referencing. And if you really want to know the ins and outs of it, you're going to have to go into the study and then read kind of, you want to find out the p values and what kind of statistical analysis they did in order to actually say this. So that'll be something that we'll do. And if we find anything interesting, we'll come back and talk about it. But I think another thing that's probably what I could suspect is happening is that at least like I live in Prince George's County. There are a lot of Black physicians here, you know, more than what would be in other counties, but this is also a more affluent Black county. So I think that that might fare into it as well. But then there's also probably, we all know, like when you're living in areas of more racism, it takes away your life. So I could imagine that physicians themselves end up in places that more resemble themselves so that they're not having to face as much racism. But yeah, I definitely want to dive a little bit deeper, but it was hot news, so we had to talk about it here. So hope you all also find this interesting and look at the article yourself.
Yeah, and DM us or let us know like what you think if you read the article, if you've read the entire published paper, and we would love to hear your insights and your thoughts around it. But those are just our thoughts, and definitely a developing story and a lot to learn and take away and glean, and hopefully implement new ways to approach and improve health for Black plus populations. So, as many of you know, I am killing it on the equity in action quizzes that we've been doing. That sounds like a nervous laugh, Jasmine. I, I, I don't keep score. I don't keep score.
Oh, I think I gave you one last month. So, okay.
Hey, it's all love, it's all learning, and I hope that you all enjoy these as well. So this month is my turn to ask Jasmine a true and false question to see if she can get it correct and add to her score, or get it wrong and then I add to my score. And by the end of the year, we'll tally it up and see who's on top. And we haven't decided on what we should do for the winner, or maybe the loser does something. So let us know if you have thoughts around that as well. We'd love to hear it. So, are you ready, Jasmine?
I'm a little nervous now. You might be coming with the fire, but I got it. I got this.
Okay, well, this was information I shared during National Public Health Week, so so it was somewhere in there. Okay,
Y'all remember how I felt about Public Health Week? Okay. All right, let's go.
okay. So in 2020, the Kaiser Family Foundation did an analysis of the National Survey on Drug Use and Health. Um, in this, oh yeah. So in 2020, the Kaiser Family Foundation did an analysis of the National Survey on Drug Use and Health. And in this data, the prevalence of any mental illness for white people was 26%. True or false? The prevalence for Black people was higher.
Okay, so the prevalence for any mental illness.
Was it higher than 26% for Black people?
False.
You are right. It is. Uh huh.
It's lower, but it's probably because of an undercount, and the display of whatever mental illness is usually different for Black people than it is white people.
Yes. Hold on. Let me pull up the screen here and then we'll talk about it. Jasmine getting shit right these days. God damn it.
I always look, and you know mental illness too. You try to stop me on that.
Is that full screen? So Jasmine was correct in saying that the Black populations have a lower any mental illness prevalence than the white populations in the US. As you can see, it's 26% for whites and 17% for Blacks and 19% for Hispanics, if you're interested in that. It's also interesting that they don't have like Alaska Native American people here, but
Right.
that's a whole other conversation. Anyway, so you can see here that there was a in the statement underneath this is like a lack of culturally sensitive screening tools that detect mental illness coupled with structural barriers may contribute to the underdiagnosis of mental illness among people of color. Moreover, symptoms of mental illness or substance use disorder among people of color are more likely to be in more likely to be labeled as disruptive or criminal compared to their white counterparts. So yes, as you can see there, it mightn't be the case that Black people actually have a lower prevalence of mental illness. It's just the case that we don't have the tools, or Black people don't have the access to get screened, or if they are screened, the screening tools aren't accurately collecting that data to say that they are suffering from a mental illness, which is a whole other discussion in itself once again. But yeah, I guess Jasmine wins this week, you all. I thought I had her this week, but I did not. I did not.
I mean, on mental illness. You tried to stump me.
Hey, it was close. You almost 50%, 50%.
But you do know, like, I'm a mental health advocate. So, like, I know my stats on that.
All right, well, we know that for the other episodes, people. No mental, no more mental health questions coming. But thank you for sharing that. Let us know if you got that true or false. If you knew that, if that information was helpful, useful, interesting to you. Appreciate you all.
Yes, this has been a good one. I like this one. See, this was a happy one. I don't think we talked about anything that was like overly depressing.
That is true. That is true. It has been a mostly happy episode. So I hope that you all are able to take that into your Mays and have a great start to your summers. And yeah, we enjoyed having this episode. I look forward to having more conversation. This was a different than our other episodes. We interviewed someone or had a conversation with them. Let us know if you like that. If you'd want us to do more of that in the future, definitely like to hear what you all think about it.
Yes, please leave some comments. We still have our surveys open. So you can always leave comments. You can even send voice notes on Instagram and we'll put you in the episode if you want to be famous, you know.
Hey,
All right, y'all. We'll see you in May.
peace, everyone.